All right, we are live here. Thank you for you guys bearing with me as I'm kind of trying to put all these things together for the live stream. So, as you guys are kind of coming in, I will be checking because we're actually doing this both on Facebook as well as YouTube. We're live streaming, and this is kind of my first attempt to kind of do that as we kind of talk about fasting and answering your guys' questions about fasting as you're coming on. So before anything further ado, kind of just with the intro, if this is your guys' first time on the YouTube channel here at the Dr. LeGrand channel, go ahead and consider subscribing. And then I'm just going to go ahead and start with the intro, and then we'll get right into Q&A. Hi, I'm Dr. LeGrand, and I am a family doctor out here in the state of Washington, where I primarily focus on holistic medicine and conventional medicine, bringing those together to help my patients with their conditions. So if this is your first time on our channel, consider subscribing if you want more information on health tips, on fasting, intermittent fasting, and other detoxification videos. All right, so as we're just started with the live stream, just want to kind of mention to you guys that I am on other social platforms. If you guys are interested, I'm on Facebook, Twitter, as well as Instagram. Now on Instagram, what I do is I kind of show some of my drawings that I do for some of our videos, the fasting videos of the animated videos that I do. And I'm working on one currently of the benefits of fasting with digestion. So that's still in the works. It just takes time to do some of these animations. So if you guys are interested in my working progress with these videos, I do post some of the drawings on Instagram, as well as some other quotes that I do on Instagram. And then on Twitter, I'm trying to get more into using Twitter. And Twitter is something I want to maybe start posting, maybe some fasting articles, some research articles, and maybe some other quotes and some other links of interesting articles around fasting. Then, of course, Facebook, it's kind of a combination of doing things of talking about health tips, other quotes and images. So you guys can follow me on one of your favorite platforms, and it's just at Dr. LeGrand, spelled out that way right there. So if you guys are interested, you can just kind of go right on there. All right, so really, there was a few questions that were asked just recently. Oh, excuse me. There's a few questions that were asked beforehand before I started, and I just want to kind of get to those questions here. And then, of course, you know, if you're on the chat, want to ask some questions during the chat, just go ahead and write down those in the comments, and then I will answer those questions that you guys will have about anything about fasting, intermittent fasting. Okay, so I'm just going to get to the questions that were asked previously. All right, so the first question that was asked was around dry fasting. Somebody asked what my thoughts were on about dry fasting, how often should you do dry fasting, how long should you do dry fasting. Really, when it comes to dry fasting, I would only recommend for people who are very experienced fasters. I wouldn't jump right into doing dry fasting right away. Start with water fasting or doing intermittent fasting, especially if you haven't done any type of fasting. I typically will do dry fasting maybe like once a month for 24 hours. Now, the benefit of dry fasting that is believed, and also some research with dry fasting, is that 1 day of water fasting is equivalent to 3 days of dry fasting. So that's what kind of the research has shown, or at least the belief is and theory around there. And the reason being is when you're doing a dry fast, and what that is you're not drinking any water or foods, and there is a soft dry fast and the hard dry fast. A soft dry fast is where you still take showers, brush your teeth, wash your hands, still exposure to water. But then when you are doing a hard dry fast, you're not exposing yourself to any water, so you're not taking any showers, wash your hands, or brushing your teeth, any exposure to any water. But what the research has shown is that when you're on a dry fast, now again, really, I wouldn't highly recommend doing dry fasting, especially a very long-term phase if you are not an experienced faster, especially if you don't have a doctor monitoring and checking on you. You need people checking on you if you're planning on doing something like this. But anything that we discuss here is more just for educational purposes. It isn't to replace medical advice, so that just everybody kind of understands that. But really what we have to kind of keep in mind about dry fasting is when you're doing a dry fast, your body still needs water. And when you're not consuming any water, what that will do is the body will try to find water elsewhere in the body. So autophagy levels will increase even more so through dry fast, as well as weight loss will decrease, because what it's doing, it will essentially take fat cells to be able to consume and turn that more into water, because fat cells has the hydrogen bonds, and then of course in the oxygen we breathe, because water is hydrogen and oxygen, and it'll start turning that into more water. But because our body does need essentially water at a time, so it will find ways to create water, and it'll get that from weight, from our fat, as well as other unnecessary cells that our body needs. So that's why you could see the autophagy levels increasing. Now, as far as how long you should fast, I personally just do a dry fast once a month for about 24 hours. Maybe I'll push it to 36. But I really kind of typically will stick more to water fasting, just because there could be a lot of symptoms when it comes to dry fasting. Even Dr. Fung, if you guys are familiar with Dr. Fung, he's kind of one of the big, heavy researchers in the medical field of studying for fasting. And even in his book, The Fasting Guide to Intermittent Fasting and Fasting, if you haven't read it, great book. But he talks about a little bit about dry fasting, and he doesn't highly recommend it for prolonged uses, or like at least prolonged days with dry fasting. Doing it for 24 hours, 36 hours, some people doing 48 hours. Again, it just depends how experienced of a faster you are, how much your body can handle it. But that was just one question that somebody had about dry fasting. The other question that somebody asked that I'll probably do another video. I'll probably also do another video on dry fasting. But this other question was a great question, is usually when you're fasting, you will have a lot of pushback from family and friends. I know for myself personally, when I started doing fasting, I actually started doing fasting when I was a teenager. Actually, even before that, I think I started when I was about 11. Now, I don't recommend it for young people because you're developing. Doing 24 hours fast are fine. That's what I did when I was about 11. Once I kind of got more past the development stage, then I started doing more extensive long fasts. But even then, I got a lot of pushback from friends and family, thought I was crazy. So that was about 20 years ago when I started implementing fasting. And back then, intermittent fasting wasn't talked about. Fasting, for religious purposes, yeah. But if you did it outside of that, you were thought of somebody killing your body, starving yourself, and you had to deal with that a lot. Now, what I recommend when you're dealing with going through a fast, it's best to just not really tell anybody about it, because people just won't understand. Now, you can find people that might have more of an open mind to it, or they are experienced fasters. Yeah, you could definitely talk to people who are experienced fasters or have done fasting and understand the benefits from it. But for people that you just know are not, can understand about fasting and what you're trying to accomplish, it is best just not to tell them. From my own experience, it's just best not to, because what happens when you're trying, especially if you're doing a long, extended 7-day+ fast, that can be an issue if you're trying to really accomplish the things you want when somebody just wants to tell you that you're crazy. Emotions can run really high, and you can you're already dealing with all these kind of symptoms of trying to accomplish what you need, so it's best to try to avoid that. So continuing on, so really back to the social aspect, the other things that you want to really try to avoid, not only not telling people that you're doing fast or an extensive long fast, but trying to avoid any other social exposure while you're doing extensive long fasts, because the commercials that you see, food commercials, bunch of different things that can be an issue for people when they're trying to go through a fast. But really, when you're trying to do that fast and you are watching TV, that could just make it even more difficult. Or if you are on social media all the time, that can make it even more difficult. However, there is a lot of support groups on Facebook, and those I would definitely encourage because they're going to be more supportive. So if you are struggling, feel like that you're the only one that is fasting, I highly encourage doing a support group. In fact, I'm interested in probably doing a Facebook support group. So if you guys are interested in that, go ahead and leave that in the comments section below, where I can be able to create that support group for fasting and intermittent fasting. That way you guys can ask questions for me directly, and it's a little bit more private setting for people to ask questions versus on a more of a public setting, because some people don't really want to discuss certain things and certain conditions that they have when it comes to fasting or doing intermittent fasting. But so if you guys are interested, go ahead and leave that in the comment section below, and I will consider creating a Facebook group for people to support people while they're going through fast and doing intermittent fasting and just sharing ideas. That way we kind of create this kind of community for people as they're going through fasts. The other thing that I've considered doing, as well as we've talked about, I've kind of mentioned about doing these live Q&A shows, and you guys showed some interest doing the live Q&A shows. So that's why I'm kind of just experimenting. This is my first one. Technology really just, I kind of made this really kind of stressful. In fact, I believe I deleted the original Facebook live account that was supposed to be running this because I was doing several tests. I just wanted to make sure everything was in sync before I started the live show, but really I kind of messed it up, I think, at the end. So as I keep on doing these, I'll get better at it. So please bear with me as I'm trying to do these Facebook Q&A live stream shows on fasting. But the other interest that I've been thinking about is also doing podcasts. So if you guys are interested in me doing podcasts, go ahead and also leave that in the description below, because what we could do with podcast is we can do where people actually can call in and ask questions versus the Facebook live chat. You would have to type in your questions, so it might be more beneficial if you can kind of call in and do the podcast. Just curious what you guys' thoughts on that, about doing a live podcast or not. But it's just my thoughts of kind of maybe having a little bit more opportunities for you guys. And of course, you can also even listen to the podcast on the road where it's not eating up your data. So just let me know what you guys think about that. But if there's no other kind of questions, I know I kind of just really, I'm sorry that I really kind of ruined the live stream, as far as I know people probably signed up and then I accidentally deleted it. So probably did not get that notification. I will do better next time. In fact, I probably will do another live stream next week sometime, possibly, or maybe in 2 weeks. It just depends. But I will make sure to allow that notification, set that up for people who are interested in getting their questions answered about fasting and intermittent fasting. Okay, so I think that's it today. It doesn't seem like there's any other questions that were answered for today. And so if you guys are interested in other questions for maybe coming up Q&A questions, go ahead and leave those in the comments section below if you missed the live stream, and I'll make sure to answer those questions. As always, if it's your first time on our channel, you can go ahead and subscribe to our channel. We talk about fasting here on this channel. In fact, I am going to probably move towards more doing fasting videos on this channel, because that seems to be a little bit more of an interest of people, of me doing more fasting videos versus the other health tip videos. I've also been thinking about even doing a day, certain days of the week, where I would do fasting with history. So looking at history about people who've done fasting, I think that'd be a kind of interesting topic. So again, leave a comment section below if you guys are interested in me doing stuff like that, looking back at history and just talk about certain figures in history that have done fasting and what they gained from it. I think that'd be really interesting for myself and maybe for you guys included. But if you have not subscribed, just go ahead and subscribe to our channel. And until next time, I love you guys. Thank you for all your support, and I'll see you next time at the Dr. LeGrand Show. Thanks. Bye.